Assalamualaikum. The general pathology practical which we are going to discuss today is chronic venous congestion. In hemodynamics, we deal with flow and distribution of blood and fluid within the body. In hemodynamic disorders like hyperemia and congestion, these are the terms we use for increased volume of blood within the dilated vessel of an organ or tissue. Now let us discuss the difference between hyperemia and congestion. Hyperemia, also called active hyperemia, it results from augmented arterial inflow. The affected tissue is reddened because of engorgement of tissues with oxygenated blood, like in muscles during exercise or in inflammation. Congestion, also called passive hyperemia, results from diminished venous outflow. The affected tissue has a red-blue color due to accumulation of deoxygenated blood, like in cardiac failure and obstructed venous disease. Chronic passive congestion, edema of lung, indicator of left ventricular failure. Chronic passive congestion of liver, kidney, spleen represents an indicator of right heart failure. So congestion is an increased volume of blood in a particular tissue. It is a passive process resulting from impaired outflow from a tissue. The types are localized, systemic, acute, or chronic, the more common being chronic venous congestion. Looking at the local and systemic types, the local results from obstruction to venous outflow from an organ or part of the body. Example, portal venous obstruction in liver, cirrhosis, blasters, tumors, pregnancy, and hernia. Systemic occurs mainly due to engorgement of systemic veins, example in right and left-sided heart failure and diseases of lungs interfering pulmonary blood flow like emphysema and fibrosis. Moving on to the morphology of acute and chronic venous congestion. In acute congestion, the vessels are distended and organs are hyperemic. Capillary bed congestion is also commonly associated with interstitial edema. In chronic congestion, capillary focal may rupture, causing focal hemorrhage. Breakdown of erythrocytes leaves residue of hemosiderin-laden macrophages. Parenchymal cell atrophy may also be present. Grossly tissues appear brown with contraction and fibrosis. Commonly affected organs are lungs and liver. Now let's discuss the chronic venous congestion of lungs. What is the cause? Left heart failure, that is myocardial infarction, cardiomyopathy, mitral valve disease, so that there is consequent rise in pulmonary venous contraction pressure. Grossly, the lungs are heavy and firm in consistency. The section surface is dark, rusty brown in color, referred to as brown induration of lungs. What are the microscopic features of venous congestion of lung? In acute pulmonary congestion, the alveolar capillaries are engorged with blood and septal edemas are also seen with transudate in air spaces. In chronic pulmonary congestion, the septa are thickened and fibrotic. A rupture of dilated and congested capillaries result in minute intra-alveolar hemorrhages. Hemosiderin-laden macrophages, heart failure cells are also seen with edematous to fibrous septa brown induration. Let's discuss about the chronic venous congestion of liver. What is the cause? Right heart failure, occlusion of inferior vena cava portal obstruction vein. What is the gross appearance? The liver is enlarged, firm. The cut surface shows alternating dark areas of congestion with pale areas of fatty change, giving the liver the nutmeg appearance. In long-standing conditions, the size of the liver is slightly reduced due to fibrosis and development of cirrhosis. In cirrhosis, the fibrous scarring of the liver impairs return of blood to portal vein, thereby increasing venous pressure in portal vein tributaries and causing fluid to leak in the peritoneal cavity. The microscopic features of chronic venous congestion of liver. In acute hepatic congestion, the central vein and sinusoids are distended with blood. central hepatocyte degeneration is seen. The peripheral hepatocytes may only develop fatty change. In chronic hepatic congestion, centrilobular necrosis with loss of hepatocyte, hemorrhage including hemosiderin-laden macrophages, hepatic fibrosis may occur in long, severe cases of congestion. Now, this is the diagram which you have to draw in your practical notebooks of chronic liver congestion. Here you can see central hemorrhagic necrosis, fatty change, the portal triad, which consists of the hepatic artery, the portal vein, and the bile duct. The hepatic artery carries the oxygenated blood to the hepatocytes. Portal vein carry blood with nutrients from small intestines. Bile duct carries bile products away from hepatocytes to the larger ducts and gallbladder. Thank you. All students are required to draw the diagram with correct labeling on their practical notebooks and send copies, and the attendance will be marked accordingly.